some important information this morning as the beach season kicks off today. Last summer, 7 people drowned at city beaches, the highest number of drownings since 2019. Now, according to the Centers for Disease Control and Prevention, drowning is the leading cause of death for children ages 1 to 4. It is the second leading cause of injury death for children ages 5 to 14. About a third of Black adults surveyed said they don't know how to swim. That's a significantly higher percentage than other racial or ethnic groups. Joining us this morning is Dr. Alexander Arroyo. He is the Director of Pediatric Emergency Medicine at Maimonides Health in Brooklyn. Great to have you with us this morning, Doctor. We do appreciate it. I want to start with those numbers, those stats. When you hear those numbers, what does that say to you? How does that hit you?
Well, for me, it means that, it's important for us to teach our kids how to swim. It's one of those things that's one of those basic life skills that I think everybody should learn and do. And the earlier you could actually do that, the better it will be for your children. That first stat where it's the leading cause of death for kids between 1 and 4 years of age is frightening, actually. And it's something that's potentially preventable by either teaching them how to swim as soon as you can and or by using safety devices.
What do you see in terms of, from your perspective there, why does this continue to happen? Is there a reluctance to teach kids to swim? What can you tell us in terms of what you have experienced there?
I think it's probably multifold. The fact that, small kids are difficult to sit down and teach them how to swim effectively. There's not a lot of programs that exist that teach really small children how to swim. And it can be a difficult thing. And some kids are afraid of the water as well. So it could be, the fact for that. And also the fact that at times when water sports and pools get open, people don't really respect the fact that it just takes a minute to 2 minutes for a child to drown in any body of water. I mean, I've had many kids who come in, and it's not just pools, it's not just beaches. It could be bathtubs. I've had a kid drown in a small bowl of water, in the toilet bowl, in a bucket. It could be anywhere, and it's things that you won't think about. If someone leaves a bucket of water in the garage and a toddler walks in and tips over and falls in, they could drown pretty easily. And again, it's just that 1 to 2 minute period that they may be out of your sight for. That's potentially the scariest thing that could happen.
And doctor, let's talk about some specific safety tips for families this summer at the beach and the pool. These are very important. So we'll start with that one. Dress children in bright swimwear so you can easily spot them in the water. Designate a water watcher, someone responsible for supervising children. And you want to point out the difference between certified life-saving devices like life jackets versus swim assistance devices like those pool noodles. We'll start with that one there at the bottom. So a pool noodle it'll basically help you learn to swim, train you, but it may not necessarily save your life. So talk to us about those two things there.
Correct. So the only thing that really is, a life-saving device is a life jacket, because it keeps the head above the water. And that's what you really want. So, those water wings, those floaties that we see on a bunch of kids at the beach and the pool, they're great if you're watching the child. But the problem is that there's no guarantee that if they land in the water, if they're swimming, they're going to wind up face up and not face down. Same thing with the pool noodle. You can hold on to it, but if you're getting tired and you let it go or it falls out of your hands, again, you could fall in and drown. So they're fine if you're actively watching whoever it is who's using them. But if you're not, the most important thing is the life jacket. And as far as that water watcher goes, anytime you're by the pool at all, even if it's a lifeguard, it's important to keep an eye on the kids. And it's not just your kids, right? It's somebody else's child who could potentially drown as well too. So watching them and ensuring that someone is designated to do that, that's not on their phone, that's not distracted by sleeping or suntanning. It's really like the most important thing you could do is pay attention and make sure that you consistently see them. And again, keeping them in bright clothing really helps. My kids are always wearing bathing suits that are bright yellow or bright orange with a top on as well. That's the same kind of color. So I can immediately spot them out wherever we're at.
Yeah, in our final moments here, just some last words for those, maybe some families out there who still, have not gotten their kids to a swimming lesson, and, the beaches are opening today and this weekend, and pools will soon be open. What do you tell them?
Get it done. It's a skill that they will have for the rest of their life, something they will use forever. And I think it's super important that everybody knows how to swim. and it could save their life. It could save somebody else's life. There are plenty of New York City programs out there that teach kids how to swim. And it's just one of those things that it just like riding a bike, you just got to do it.
Dr. Alexander Arroyo, thank you so much for your time this morning. We really do appreciate some important information for families in this city. Thank you again.
Great. Thank you.